Okay guys, so in this video we're going to go through a MET technique for the QL in patients with lower back pain complaints. So Glenn, how would you do that?
So same position here, again depending on your client you might choose to put a pillow under their hip that's on the couch. In this case I've chosen to do that because when Kate was flat on the bed the muscle was in too much of a shortened position. So it's important as well that you explain the movement that you want them to perform. I think the biggest mistake that clients make here, or the biggest mistake we make in explaining it to them, is they try and abduct their hip, they try and lift their leg, which is a natural thing to do in this position, especially when you see the handhold that I take with the leg. So what I normally say is that I want you to hitch your hip. Imagine that you're lifting your hip up and hitching your hip exactly like that. Get them to perform that a couple of times before you actually go on to do the MET. The other thing to be aware of is that the top of the iliac crest, when you push on it, because that's the area that you're going to use to create a block, is quite sensitive. So you want to make sure that you place a towel or something soft over there, so that you can make it a little bit more comfortable for your patient. I'm going to put that onto here. Then I'm going to lift the leg. You'll notice I've got Kate quite close to the edge so that if needed I can go lower. So we're going to come into here. My hand is now on the top of the iliac crest and I'm going to say, Kate, just let your leg go completely heavy for me. Let me take the weight. Starts to drop. Okay, good. I'm going to hold that position. Now hitch your hip for me. Hold that. Hold that. That's good. Keep going. Keep going. I want to hold for about 9 seconds, 10 seconds, and then release. Okay, good. And then we're going to go a little bit lower. Same thing again, hold that, same technique, and release, nice deep breath. I always wait for them to exhale before I try and increase the movement, and then we can go a little bit further again, and same thing again. I would normally do about 3 repetitions of this, and then I'll bring you back to the start position. The only other thing that I would explain to the patient is that it's not 100% contraction, so they're not trying to do their full power against you. I usually use about 30% when I explain it to them. Yeah,
perfect. And I think, as I was saying to you before, there is, generally you can use the 3 times for 8 to 10 seconds, but you could quite easily do this until you felt it was really releasing, and it might take longer than that. And again, if you're doing lots of repetitions and it's not improving, then it might be not the treatment not the treatment technique of choice. But you might need to do it for longer than that period of time in order to actually get that release. And I really like what Glenn said earlier, and often I'll actually cue my patients to actually breathe out. So breathe out as I'm letting go, and I think that sometimes that they'll really let go a little bit more. And it's a really effective technique, the MET, for reducing tone in the muscles. Thanks for watching, guys. I really appreciate your time, and hopefully you got a lot of valuable content out of the video. Please don't forget to subscribe by clicking up here. This will mean that you don't miss out on any of the Strength Physio videos. Also, check out my next video down here, and I will hopefully see you on the next video. Cheers, guys.